In February 1951, a 31-year-old woman stepped into the Johns Hopkins Hospital in Baltimore, Maryland, one of the few hospitals at the time that treated Black patients. Diagnosed with epidermoid carcinoma in her cervix, a type of cancer that originates from the cells that line internal organs, this woman was under the care of Richard Wesley Talind, one of the top surgeons and cervical cancer experts in the country. Though he was known for his impact on clinical gynecology and cervical cancer treatment, Talind, like many other doctors of his time, also conducted research on patients from public wards without their consent, which is clearly unethical based on today's standards. The individuals from these wards were usually Black and indigent, one of the most vulnerable groups in society. This woman fell into that category. At the start of her treatment, the woman did not know that Talind had a deal with George Guy, Hopkins' head of tissue culture research, where Talind would supply cervical cancer tissue to Guy in exchange for Guy growing the cancer cells in his laboratory, which would aid Talind in his research. As the woman lay anesthetized on the operating table before her radium treatment, her doctor secretly collected a small sample of tissue from her tumor and sent it to Dr. Guy's lab. This woman was Henrietta Lacks. Though she passed away in October 1951, her cells lived on for decades after and formed the backbone of future scientific research and medical discovery. Unlike all other cells that Dr. Guy's lab attempted to culture, which usually died within a few days, Lacks cells thrived. What started as a dime-sized piece of a tumor grew to fill thousands of test tubes, reproducing every 24 hours and growing 20 times faster than healthy cells. Lacks cells were named as HeLa cells, and the name Henrietta Lacks was lost to the past. HeLa cells were central to the creation of the polio vaccine, chemotherapy, genetic cloning, and in vitro fertilization. They went to space, and scientists calculated that there are enough HeLa cells to wrap around the Earth 3 times. Ironically, the cells of Henrietta Lacks, a Black woman, were used to make innovations that were only available to white people at first. While Lacks cells were treating HIV or being used to discover the normal number of chromosomes in human cells, Lacks' children and families struggled from poverty, lacked proper access to healthcare, and were unaware that Henrietta's cells were even alive. Henrietta Lacks' story is a reflection of how American science is built on racial oppression. This is only a part of the broader and deeper history of the exploitation of Black bodies for science. One of the most infamous cases of medical exploitation of Black people is the Tuskegee Syphilis Study. From 1932 to 1972, American researchers conducted experiments at the Tuskegee Institute in Mason County, Alabama, about the progression of syphilis. This study experimented on 400 Black men with syphilis. These men were uneducated and poor, and most of them were sharecroppers, which are farmers who worked on a white person's land for a portion of the crops produced on that land. Tuskegee's researchers appealed to these individuals with free physical exams, medical treatment, hot meals on exam days, and rides to and from the hospital, which meant access to the city. These incentives were a form of manipulation, a distraction from the fact that these men did not know how they would be treated, or, for that matter, untreated, for the next decades. The men in this experiment were not even aware they had syphilis, meaning they would not seek out treatment, and they risked spreading the disease to other people. When penicillin became a known treatment for syphilis in the 1940s, Tuskegee's researchers denied participants of this medicine. The 400 victims of this study needlessly continued to suffer from syphilis for the remaining decades of the experiment. They faced consequences including paralysis, blindness, and death, all of which could have been easily prevented. The Tuskegee Syphilis Study is an example of how American scientists have treated Black people's lives as expendable in the name of science. This human experimentation also dates back to slavery. In the 19th century, the Dr. James Marion Sims conducted life-threatening surgeries on enslaved women and teenagers without any anesthesia and without any consent. These experiments caused excruciating pain and almost killed one woman with blood poisoning. Despite his cruelty, Sims was honored as the father of gynecology, with a statue in Central Park in New York City, which was only taken down in 2018, and another sculpture in Alabama that stands to this day. It's easy to dismiss stories like these as things of the past. However, With a large number of Americans still respecting people like Sims while being unaware of their wrongdoings, it's clear that more awareness about medical exploitation is necessary. Of course, modern science is guided by a set of ethical principles that weren't as clearly defined in the 1900s. The first is individual autonomy, the right to make your own decisions based on accurate and thorough information, a privilege that the victims of the Tuskegee Syphilis Study and Henrietta Lacks did not have. The next two, beneficence and non-maleficence, the idea is that the benefits of research should outweigh the risks, and that participants in an experiment should not be subjected to any harm. And the fourth is justice, where research is fair and does not unnecessarily include vulnerable populations and compensates people for being part of a trial. Though researchers, scientists, and doctors alike learn these principles and are expected to make decisions off of them, it does not change the fact that the history of racial bias and discrimination impacts our society today and influences these individuals to make potentially unethical decisions. Many doctors and health professionals still believe the inaccurate claim that African Americans feel less pain than other races. This idea is reminiscent of how researchers in the 20th century justified cruel experiments on Black individuals, using the idea that diseases affected Black bodies differently than white bodies. Modern healthcare is still full of discrimination, and the lack of access to health insurance, healthcare facilities, and treatment among many Black communities. In a 2020 poll, 7 of 10 Black Americans said that they were treated unfairly by the medical system, and 55% said they distrust it. People who mistrust the medical system and their healthcare providers are less likely to seek medical care or advice. Since they are reluctant to receive this treatment, their health often worsens. It is important that these individuals are not blamed for their failure to seek out treatment. The medical system and healthcare providers have failed Black Americans in many ways. It is essential that we acknowledge American science and medicine are built off of discrimination and the exploitation of Black individuals, and that this discrimination continues in the present. As we move into a more equitable future, where people receive the same standard of care and ethical treatment regardless of their race, gender, or ethnicity, it is important that we challenge racist biases that may not be obvious at first glance. By confronting this legacy, we will take the first step to rebuilding trust and embracing justice within medicine and science.